Good evening, ladies and gentlemen. Today I shall be revealing a few information as it borders on our products, and the reason is simple. Over the years, we have had people call us and are always pushing on to understand how true our drugs work. And for a good number of people, not just the efficacy of the drugs, but also for the fact that they have had one or two challenges over the years when it comes to people who make claims for cures of various ailments, such as the ones we mentioned. So I am going to take a few minutes of your time to explain or analyze, and of course, not just analyze, but to also show you evidences of some of these things that we have been talking about. Having said that, let's roll. Now, in this very short time, these are the expectations that you'll be getting from us. One, I will be talking about this very session, which I have just talked about. Number two, the challenges with people's perception and what we have done. And the next one, which is the last, is the testimonials of what you can get or you can do to take advantage. Now, talking about the introduction, I have spoken at length when I started, and I talked about basically why we have decided to come up and talk about this today. And the reason is not far-fetched. The fear of people, the challenges of drug taking or herbal medications being taken by people, discouragements from one angle or the other, and then to also let you see what these things are doing so you can take advantage at this point in time. Now, the basic challenges people face when it comes to herbal medications starts with their fear of being scammed or defrauded. And we are going to talk to you about that now and what you should do about it. Now, the first thing I want to say is that, first and foremost, we have been here for more than 30 years. But our medium for which we have been reaching out to people, which is the Facebook page, where you're probably watching it right now, has been here for more than 10 years. And we have our address clearly spelled out there, here in Abuja. And we're saying that over this period of years, nobody has said they have been scammed or defrauded by us. And the reason is simple, because we are as straightforward as possible. If you make payments to us, you get your medications. Now, the second part is the side effects and the efficacy of these drugs. As a matter of fact, there is no way NAFDAC will approve the distribution of our drugs and consumption if there are side effects. So that has been taken care of with a NAFDAC number on it. But then I want to say that when it comes to medications, including orthodox medications, you find people who take medications and what works for Mr. A may not work for Mr. B. But then we've gone ahead to say that anytime you have such experiences, all you simply need to do is to connect with us so we can find a better solution. It could be an increment in your dosage, or probably that your system does not want it at all or does not work with it at all. As a matter of fact, we do not have any reason to present to you what doesn't work. And that is why I will go further to showcase some of the testimonials we have had over the years, just a handful, so you can see. Now, we also would want to say that when it comes to these medications, do not expect instant results just like chemical drugs. And that is why we usually place our patients on a 3 to 6 months or 9 months basis, a duration rather, depending on the ailment, so that we can get the needed results. So, this is not to say that we don't have some of our drugs that react instantly. For example, the new formulation we have for diabetes, the one we have for ulcer, the one we have for malaria. Those ones work instantly and you can begin to see results. For the other ones that do not have symptoms, symptomic effects that you can easily see, those ones work gradually, and over time it clears out the virus or the bacteria. Having said that, we would advise that whenever you want to use our drugs, try as much as possible to speak with us directly first, so that you can be guided properly when using it. With that, you will not fail, you will not lose. Now, I want to rush in because this is basically why we are running this webinar tonight. And I have handpicked just a few in the various ailments so you can see the test results and their responses. Now, permit me to say that these guys have not authorized us to present their results openly, so we have gone ahead to shade their details so that you don't get to see them, because, of course, we have a confidentiality agreement with our patients. So we have presented here about 6 of these patients with their positive test results. Now, this is the first one, hepatitis B and C patient. This on our page, you can see it clearly. I know you can't see it here. You can see it clearly on our page where he attested to the fact that he took our medications and in no time he got cured. This is the test result. We initially had an agreement with him that we were going to publish his results, and he agreed. He promised he was going to allow us. But after 2 days, he called us back and said, please, the calls I've been getting is just unbearable. Kindly shade all these details. And moreover, he's planning to get married, so he wouldn't want that stigmatization to continue with him. So he would have a peace of mind, and we had to shade it. So for you to see this clearly, you can go to our page. It's pinned in our page. You can see that. This is for one of our HIV patients then, who also tested positive. And when she started taking her medications, about 6 months after, she still tested positive. But they had told her that the traces were very, very faint. So she had to continue, and after the 7th month, she went again, and this is what she had to send. Doctor, my test is negative, but I will not stop your drugs. And I said, this is good news, congratulations. You don't have to stop it, please. Make sure to complete the duration. I wanted her to go through for 9 months. But as you know, sometimes they just run away. And after the 7th month, we didn't get to hear from her again. Anyway, congratulations to her. Now, the next one is from a hepatitis B patient. Rather, this is our partner who started working with us. He sends his medications abroad to US and to other countries. And this is what he had to say. He said, "Season's greetings, my friend. I have some inkling of good news. My client was using your drugs for the treatment of hepatitis, has reported some positive news after his last test. Although the virus is still there, however, it has stopped multiplying according to the results. Before now, he was using only SAB and DABs and was supplementing it with bitter leaf juice. Now I have advised him to use the full medication for at least 4 months. He has agreed, and we are planning to purchase 12 bottles each of whatever. And once I get green light, I will place my order." And that is what he wrote. And I said, wow, I'm impressed by this. And as we speak, this is more than 3 years, and he's still buying for other people, and they are taking. In fact, as at last week, he bought again for another patient. All right, that's for that. Then the next is a patient with high blood pressure. I didn't even know so much about him, but this is what he had to take, or rather what he had to say. He said, "Thank you for your understanding. The good news is that I have for you, the good news I have for you is my BP from 140/90 is now 117/77, 8 weeks of using these drugs. I look forward for more revelation. God bless you." That is for high blood pressure patient. Right. Then this one is for a diabetes patient. This one took it for less than a week. And this is what the test results came out to be. And it was forwarded to me, and I said, "Excellent, within the range. Please continue to take your medications." This one is for a colon cancer patient who took it, and he has this good news to say. Look at what he said. So, "Good afternoon, sir. Hope you had a relaxing weekend, sir. I was at LASUT, Lagos State University Teaching Hospital, last Friday, sir. My CA has reduced from 4.5 in the last 3 months to 3.08, sir. The significant level is 5. I'm still on the subparts supplements. I hope to send for the 4th set by next week, sir. Kindly suggest some tips to sustain it or to make it lower." The consultants were surprised at the level of improvement. I told them what we have been taking. Typically, they just said, okay. They were actually expecting to suggest another round of chemotherapy. God has been working wonders through the sulfate supplements, sir. I suggested them to some patients and their families. That is it. Now, those are just a few. In case you want to place an order for your own, any of these medications, any of these ailments, you can easily contact us on this number through WhatsApp in case we don't pick, because we get a lot of calls, so we respond a lot of times with WhatsApp. So these are the new inclusions we have for our medications, and these have been with us for many years. Finally, I want to say thank you, and this is how you can order. Now, for those in Abuja, you can equally pick it from our office, or you pay our dispatch rider to deliver to you at your doorstep with just 1,000 naira within Abuja, please. Now, those outside Abuja, it's between 4,000 to 5,000 naira for shipping to you, secured shipping. Now, for those abroad, we will need to discuss with you and ascertain what exactly you want, the quantity you're going to pick, because that is how DHL or UPS will determine the cost by weight. So once you're ready, you can pay into our First Bank account, which will be provided to you. Then after payment, make sure you send your full names, your phone number, your location, other queries or explanation that you want to give to us, and to this number via WhatsApp, or you call. but please, we'll prefer to answer you via WhatsApp the most. Now, understand that the current price we're giving still stands at a 30% discount, and the price that will be given to you has already been taken care of with the 30% discount. Thank you so much for listening, and God bless you. Bye for now.